Welcome to Embrace Yourself. My name is Kim, and I'm a movement specialist passionate about joy, health, and happiness. I want each of us to discover our healthiest, happiest selves, but to do that, we have to get up and move. Today, I'd like to demonstrate a fascial release for the foot and lower leg. Now, ideally, I do this bare skinned because I'm going to use tools known as the fascia blasters. I've got the face blaster and a nugget, and it's best when I can go skin to skin contact using an oil to lubricate the skin. However, I recognize there are people that don't like oil or don't want to do something on their bare skin, in which case we can use these tools over clothing. It's just not as ideal, but I want everyone to be comfortable with their own fascial program. Let's get started. I definitely will need something to heat the fascial tissue when I'm using these tools. For me and my clients, I like to use hot stones and basically work on heating the area of the skin that I'm about to work. Some people like to take a hot shower or bath. Some go to a sauna or a steam room. You could use a heat wrap, whatever works for you to heat the tissue before you begin blasting. From there, you want to place oil on the tissue that you're going to blast. And the reason for this is if you don't have enough oil on the skin, these plastic tools don't glide as effectively, and it's definitely uncomfortable. Fascia blasting your feet already is a challenge, so let's try to make sure we have enough oil. I'd like you to begin by taking the blaster and going vertically up and down along the foot. There are 3 directions that we use the fascia blaster: vertically, horizontally, and diagonally. The only rule in fascia blasting is let's not go in a circular motion. And the reason for that, the visual that works for me, I think it is winding up a spider web. I don't want to bind down the tissue, I'm trying to release it. So the reason I'm going in those 3 directions, vertically, horizontally, and diagonally, is so that I can get into all the different slings of the fascia and try and release the restriction from a variety of angles. So with plantar fasciitis, anyone that suffered from it knows how incredibly debilitating and painful this is. This is a daily protocol that I would recommend, and you can take 3 to 5 minutes every day and just love on your feet. Now, remember, the fascial system is our sensory network, and it's definitely emotionally based. So I know you've heard me say over and over, physical and emotional trauma that's stored in the fascia, we need to ask permission to let it go. We need to sit and be present with this tool and with the release that we're doing so that we get the most effective release possible. I've gone vertically. I can start working my way across horizontally. And again, go at your pace and at your depth level. I start nice and gently and just work my way in and see how it feels. I may notice a restriction or incredible pain in an area, and then I just focus and breathe. And I try and exhale that pain out, and I try to just say, let it go, release. I think a great word for 2019 is release. Let things go that seem to be bearing and weighting us down. Now I'm going on a diagonal level, and I'm just trying to work my way across, again, looking for any restrictions or adhesions. Now, in addition to the face blaster, I love the nugget because I can work and come down all the tendon lines in the foot. If you picture your 5 toes and 5 fingers, you have tendons that come down in between each of the digits. I was blessed enough to go to a 6-day cadaver dissection lab this past summer, and I have to tell you, the foot is just incredibly magical. Our entire body is really, and it's so fascinating to learn from underneath the hood. Now I know to some people they think that's disgusting to dissect a cadaver, but what an incredible gift to learn so that we can see what's going on and makes us appreciate our body that much more. From here, as I follow those lines, I'm just seeing if there's anything tight or tender. And for people that are suffering from foot pain or plantar fasciitis, this is going to be excruciating. So take your time and breathe. Additionally, I love the nugget because I like to kind of hammer into the foot, and I'll hammer into other parts of the body as well. I do it very gently at first and see how I respond, and then I can really start to dig in and kind of press into certain areas if there's pain. For trigger point, I can come in and out, so I'm pressing in and out around that area to try and get it to release. That's a great way to get more blood flow. Once I've done the foot, I can work my way up towards the calf. I like to come across the ankle. Keep in mind that we do need to have the skin lubricated. And then from there, I like to take the two prongs and kind of go through in the center on my Achilles and just work all the way up that foot and that ankle. So once I've blasted this area, I'm going to follow the same principles, going vertically along the leg and foot. I'm going to go horizontally down the tissue, and I'm going to work on the diagonal. Now, this is a great fascial release for anyone that isn't comfortable getting on that foam roller. And I had mentioned during the lower body series that I find it's hard to get a calf release with the foam roller. So this way I can work my entire calf, getting into that gastroc and soleus muscle, in addition to coming down the sides of the fibularis, brevis and longus muscles. So I'm just working through the entire lower leg. I can also hit the front, the anterior tibialis. But keep in mind, just because I'm experiencing pain in my foot, that doesn't mean that's where it's really coming from. That's why that lower body foam rolling series was so critical, because all of our fascia is connected. It's one giant sheath. So if I'm having pain in the foot, I may want to work on releasing my IT and vastus lateralis muscles in the upper leg. I might want to go into my hips and glutes. You want to work through every part of your body and just note where there's tension and where there's pain. So as I'm working and breathing, I like to continue going back and forth. One thing that I found incredibly effective for my clients as well as myself, there are times I'll get into an area and it almost feels nervy, like, oh, I don't want to be there. So I take a breath and gently kind of try again. But if it's too much, I move back to another area or on to some new area. And then I'll come back again. I'm just asking permission from that fascial tissue. Can you let me in? Can I release what's bound? I love the word release. It's one of my favorites because that's what I'm trying to do here with all of my adhesions. So once again, you can use these tools on and over clothing. Ideally, it's best to do it on your skin. And one other caveat is if you're on any kind of blood pressure medication, anything where you've got any kind of a blood issue, you definitely want to speak with your doctor before using these tools. These tools come with wonderful instructions so you can make sure you know any contraindications. But the reason I mention that is in fascial release and even on the foam roller, sometimes people will see bruising that takes place, and I know that stresses people out. I personally try not to go so crazy that I get bruising, but I realize if I am bruising, it's because there was a limited amount of blood flow to that area, because I try to go a little bit more gently with my fascial releases, and if I'm bruising, then I know, whew, I really needed some blood flow there. So work around and see what you think. Again, make sure you're following all the lines down those toes through the feet. Hammer around the area if it's comfortable to you. You can fascia blast the individual toes. For that, I do like to use my little face blaster. You can get in right at the base of the digits with the nugget. And sometimes I'll just act like it's a crayon and just scrape and work my way through those toes. So I hope this helped today with some information that you can use with the blasters. I look forward to seeing you again tomorrow.